Welcome to You and Your Health. My name is Dr. David James. Today's topic is cosmetic treatments. My guest today is Dr. Neil Goodman. Cosmetic treatments has been glamorized as a way to make you look younger and more beautiful. You can reshape various parts of your body. You can inject substances to eliminate wrinkles. You can insert prostheses to shape and contour various parts of your body. Our guest today is Dr. Neil Goodman, who performs cosmetic treatments with non-invasive or minimally invasive procedures. Dr. Goodman, will you please tell us about yourself?
Well, I've been a practicing physician for 40 years. For about 25 years, I practiced obstetrics and gynecology like Dr. James up in New York. However, the past 14 years or so, I've been involved in a career switch, which brought me to cosmetic procedures, and I perform all my procedures either with no anesthesia or with only local anesthesia. So what we try to do is we try to make the procedure less downtime, less expensive, and less risk. And those are important, and as a result, I have a very busy practice, and I enjoy doing it.
Any special training you've had for?
Early on, I took the additional training to learn how to do injectable treatments such as Botox and cosmetic fillers. I learned how to do liposuction with local anesthesia. I did do at one point some tummy tucks under local anesthesia because I did have a surgical background. But as the years have gone on, I've developed my own techniques, and I'm regularly at the forefront at national conferences, particularly on the use of fat-derived stem cells for involving them in cosmetic treatments on a minimal basis.
How interesting. What are the most common procedures for which patients consult you?
Well, most commonly, Botox, by far the most common. That's a drug that's injectable and could knock years off of your appearance, and it is very, very, very popular. And it's very safe, too.
Is that something that'll treat all the wrinkles we get around our eyes and mouths and lips and forehead?
For the most part, it's used in the upper face, and the most common areas are glabella, which is right between the eyebrows, the forehead, and the crow's feet that appear lateral to the eyes themselves. It is used in the lower face on occasion, but not frequently.
We all hear the word Botox as a standard or so, but I know there are other drugs as well, Restylane and some of the others. Tell us a little bit about them and their safety and what are they?
Well, Botox is a muscle relaxant. It binds to muscle, and there are actually 3 commercial brands that are available currently. One is called Botox, and the other is called Dysport, and one other is called Xeomin. And they all have little advantages and disadvantages. All the rest of the materials that you mentioned, such as Restylane, are cosmetic fillers. And the purpose of a filler is not to relax muscles, it's to provide volume where volume no longer exists, primarily in the face.
And their safety?
Very, very safe. They've been approved by the FDA. They're used millions of times each year around the world. The efficacy is very, very, very great. I'd like to say in 13 years of injecting fillers, maybe I have 1 or 2 adverse reactions, mostly due to the needle and the bruising that I did rather than the filler itself.
Neil, is it 13 years since you gave up obstetrics?
Actually,
since I know you're back in New York?
Actually, I did this for 5 years while I was still delivering.
Oh, you did.
It's almost 9 years since I did my last delivery.
How long, after injecting these drugs, how long does the treatment last?
For Botox or botulinum toxins of any type, usually 3 to 4 months, and then the result wears off. The patient goes back to looking the way they used to look. For fillers, it can last as little as 3 to 6 months or as long as several years, depending upon the nature of the cosmetic filler.
So in other words, every 3 to 4 to 6 months, you get re-injected and come back. There's no term limit to all the injection. They don't develop an
No,
allergic reaction or anything
no,
to, no?
no, they come back. It's like getting your hair done again and again.
And approximately what is the average cost of such a?
It depends where you go and what you use, and of course how much you use of it. I'd say for standard 3-zone glabella, forehead, crow's feet, more or less $500 would be a middle-of-the-road cost.
Sounds very reasonable to look good and to look 20 years younger.
Yeah.
I understand you also perform liposuction, and that seems to be that you, what I hear is that you performed a lot of it, and tell us about your experience with the procedure.
Well, I learned from the guy, Dr. Jeffrey Klein, who developed the method under local anesthesia. And I've made some advances personally with the use of lasers and other things that I do. And I do lecture nationally, and I'm pretty well known in liposuction circles. I'd like to say that a lot of the things I've developed are things that I discovered because of a lot of cases. I've done about 4,000 liposuction procedures in the past 10 years. And I mean, lots of times I do liposuction not necessarily to remove fat, to make things smaller, but to take fat out so I can use it somewhere else to make things bigger or to rejuvenate things.
So basically you can use it for rejuvenation of the face and the body and contouring and...
Yes, the fat has embedded within it stem cells that are immature and multipotential, and their withdrawal and preparation by very simple office procedures can allow you to put, say, fat in the face to provide volume, which the adult fat cells do, just like a filler would do. However, the embedded stem cells also provide new vascularity and new structural support. So in a very real sense, unlike a cosmetic filler where you only get volume, you get volume plus rejuvenation, and faces look better as a result, and it lasts a long, long time.
Is there any rejection of the fat at any time? Is there,
No, it
does not break down? And
some of it breaks down. It depends on how you do it. With the new methods, we can get a 60 to 80% take on the face, and even higher on the body.
And is that done in outpatient procedure in the hospital? And what anesthesia is used for?
No, it's done in my office or other offices under local anesthesia. You don't have to use local anesthesia. Others provide their patients with conscious sedation or even general anesthesia, but I do everything under local or no anesthesia.
We also frequently hear and see advertised a lot of the new lasers that are out there. And I just saw the other day about a new fat freezing laser and all the other lasers for surgical face tightening. What are they, and what's the popularity of
They're quite popular. The lasers and intense pulse light sources can provide rejuvenation of the face, remove red vascularity and brown pigment. The more ablative lasers can go deeper into the dermis and destroy portions of the dermis, leaving others okay, and rejuvenate the skin. And then there are a whole host of non-lasers, which include devices such as radiofrequency devices and ultrasound devices, which can provide significant skin tightening. And that's primarily a non-surgical treatment, and in some cases can go through the dermis all the way into the superficial fat layer and provide reduction of the fat. Now, I found that only works well when you only have a very little bit of fat. For the most part, if you have a lot of fat, you really need to go in and get it.
With this explosion of tattoos that we see all over, and a lot of the younger people and what are having the tattoos moving on a number of years from now. Do the lasers remove those tattoos?
Yes, lasers have been used to remove tattoos, to depigment, and to a variety of degrees. Different lasers are more or less successful depending upon the type of pigment. The major problem is that you're dealing with a very large array of different pigments, some of which are destroyable by a laser and some of which are only partially destroyable. So in a sense, it's the tattoo ink that is used that determines the relative success of the removal.
So there is hope in case they need to be removed at some time.
Yeah, you can certainly remove most of it. There are some faint traces. A lot of patients will tattoo over an area that just can't be removed completely.
Neil, we can go on and on. This very interesting subject. We all love the subject of looking younger and looking more beautiful. However, unfortunately, we're signaled that our allocated time has run out. I hope that in the future we can ask you to come back and go on for some more topics in this along this line.
Sure.
Thank you again for sharing with us your experience.
You're welcome.
And thank you for viewing You and Your Health on Channel 63.